Mendez, Health Equity Editor for Black Chronicles. With the current global health COVID pandemic, Black and Brown communities and low-income communities within the United States and beyond are disproportionately impacted by this virus. I am joined by Dr. Sharrelle Barber, who is faculty member at Drexel University, Dornsife School of Public Health in Philadelphia. And we'll discuss today health equity and coronavirus in the United States and Brazil. Dr. Barber's scholarship and activism focuses on the intersection of place, race, and health inequities among Black populations in the southern United States and Brazil. Thank you for joining me, Dr. Barber.
Thank you for having me, Dr. Mendez.
So there are several news stories as well as data sources that have come out recently, such as Michigan, North Carolina, cities such as Chicago, that are showing that Black populations are more likely to contract coronavirus as well as subsequently die as a result. Can you share a little bit about what we're seeing in the current data, including what you are seeing in particular in Philadelphia?
Yeah, absolutely. So the first thing I'll say is that, this is not really a surprise to those of us who study, racial inequalities and really the intersections of structural racism and health equity, right? So what we're seeing is, to be expected, given the legacy of structural racism embedded within the very foundation of our nation, right? And so many of myself and colleagues have, really already, even before we've seen the data, expected to see these racial inequalities emerge. And so what we're really seeing with places like Michigan, places like Wisconsin, for example, where you do have beginning to see higher rates of both folks contracting the disease and death, really speaks to some of the structural issues embedded within our communities. So for example, I'll start over. So for example, take essential workers, many of them low income. We know that they are disproportionately Black and Latino. We know that they are having to work even without personal protective equipment. And thereby being potentially exposed to the coronavirus, but not having, sufficient sick leave, et cetera, to be able to practice what we would call social distancing, right, during this moment. And a New York Times article just actually came out and said that social distancing really is a privilege. Not many people can work from home or opt to work from home. People still have to to go into their jobs. And again, because this virus is so contagious, these individuals are putting themselves at risk of contracting the disease. But it's not only about them, it's also about their families and their communities. So they, go to work potentially on crowded public transportation, come back home, and then, live in potentially crowded, living quarters, right? And then what does that look like in terms of transmission and propagation within communities? So you have this, higher potential for kind of contracting the disease. And then within these same communities, same segregated neighborhoods, you have limited access to quality healthcare, which prevents testing, which prevents treatment. And then if you are able to interact with the healthcare system, we know that there's a long legacy of discrimination and bias that can happen where individuals might not even be treated well when they get there. And then, we can also talk about some of the structural constraints, right, to other preventive measures that have been recommended. So for example, even hand hygiene or washing your hands. Right, we take this for granted, but some communities, lack access to clean water, or folks' water has been shut off. Right, so just even that basic principle of washing your hands could be constrained in certain communities. And I've already mentioned social distancing, but again, you see this cycle kind of propagate and really lead to higher transmission rates within these settings. And then in terms of mortality, right, we know that Blacks have a higher proportion of many of the chronic conditions that lead to more severe cases and lead to more likelihood of death, right? So things like diabetes, hypertension, all those, if we just take those two, are much higher in Black populations than the rest of the population. And we know that's patterned not only by race, but where people live. and also pattern by region, because the southern part of the United States, which I think we need to be paying particular attention to, has higher rates of all of those things as well. And so, I mean, you know, this virus really just exposes the existing racial inequities in our society, and we're seeing that play out in the data.
Thank you. So there's the Pennsylvania Disease Prevention and Control Law of 1955. So here in the state of Pennsylvania, that has been cited as preventing the state from providing certain data sources or data points over the past several months. So can you talk a little bit about what that means and the implications here in the
Pennsylvania? Absolutely. I think that law, coupled with the fact that as a whole, the federal government really failed us in terms of testing, surveillance, really identifying folks, is really going to lead to may lead, if you will, to an undercount of actually who has the virus, and which inhibits prevention measures. So if you don't know you have it, we know that folks can have it and be asymptomatic. But if we're not doing widespread testing and not understanding who has it, that again leads to higher transmission. And then this not being able to release data, you know, really hinders us from, you know, being able to put in place the proper prevention measures in certain communities, right? So we don't really have a full picture of what's going on. And when you have a virus like this that's highly contagious, where we're learning as we go with regard to how fast it transmits and how, you know, long it stays on surfaces, et cetera, not having that really critical data actually prevents us from doing the best we can in terms of really kind of containing. And we're really past containment, right? Really past the containment stage, but it really helps us as we're trying to mitigate the numbers within our state. So I do think that, along with the fact that we've had this very piecemeal, and I've called it reckless response from the federal government in terms of testing and really getting information out about cases and who those cases are and what those demographics are, I think is really hindering our prevention efforts in the state.
So you also have collaboration in Brazil. And work explicitly with Black and Brown communities there with respect to racism and health inequalities. Can you talk a little bit about the discussions you've had with your colleagues there around coronavirus?
Right. So again, as we expected, you know, things to unfold along racial lines due to structural racism, due to the long legacy within our nation. We're seeing, you know, my colleagues in Brazil are seeing the same things there. So they recently, many of them were interviewed by their kind of National Public Health Association, which is called Abrasco, and they really outlined some of the same things we're talking about here. For example, you know, the favela areas, or what they would consider the segregated neighborhoods, which are predominantly Black and Brown. In Brazil, you know, they have, and there's really, you know, widespread lack of access to running and clean water, lack of access to sanitation, really crowded housing conditions where, you know, any talk of quarantine or self-isolation is nearly impossible, right? And just, you know, conditions that are going to make the transmission of the virus within these communities so much quicker than, you know, other parts of cities, right? And so they're talking about that. They're talking even about, and that, you know, we here too are also seeing kind of how this is impacting the prison population. So with, you know, mass incarceration, both in the United States and Brazil, we know that prisons themselves are, you know, really kind of petri dishes, if you will, for the viruses, close living quarters, limited access to hygiene, et cetera. And so what we're even seeing in prison populations, both in the United States and Brazil, really borders on what some folks call genocide in Brazil. And they're really pushing like the way that they've neglected in this moment, but also the decades of neglect in certain communities in Brazil, really borders on genocide. And so what you see in Brazil is many of the scientists, the researchers linking up with social movements, right, to really try to, you know, do what they can in this moment, because the federal government is really absent. And when I say absent, I mean the federal government, particularly the president Bolsonaro, has denied that, you know, the coronavirus or COVID-19 is really a risk. He's, you know, he has continued to spread lies and misinformation about the high risk within Brazil. And not only are Blacks in the country really appalled by his actions. You know, a lot of folks are, because he's literally become a health threat to the whole population because he hasn't taken it seriously. And so statement he made was like, well, if Blacks stopped working, the whole economy would stop. He doesn't care about, he cares about the economy, he's not caring about individuals and what that impact it'll have on the Black community. So it's really a dire situation there, as I've talked to my colleagues, but as they always do, you know, they're mobilizing, they're acting in the ways that they can to mitigate, you know, to the extent that they can, some of the death and some of the suffering that'll happen in those communities.
Mm-hmm. So a lot of parallels between, you
A
know.
lots and lots of parallels, right?
So what are some of the ongoing initiatives and critical next steps you've been involved in with respect to inequities related to coronavirus and beyond?
Yeah, so one of the things, so last year at SCR, a group of us really kind of divinely orchestrated, we say, we just all came together and began what's called Black Equity Matters. And so at the onset, about 2 weeks ago, when we really saw this ramping up, I had the opportunity to write a blog for the Interdisciplinary Association for Population Health Sciences. And I said, why don't we just write it together? And so we, just to put the ideas out there, because again, as we see the mainstream media talking about this, it's not until now that we're seeing the data that they're talking about race, but we knew it was coming, right? And so we wanted to be able to frame, you know, how is structural racism operating in this moment? And what do we need to be doing in order to really say, not only is this a population or kind of a global pandemic, but there's some particular and very specific things we need to be paying attention to along racial justice and social justice lines, right? And so we need to be talking about structural racism. We have to really mobilize data for action so that we are making sure that the most racially marginalized groups aren't left behind in this pandemic. So that's one thing, just really trying to help shift the narrative from this to include a racial justice and a social justice lens. And then the other thing I'll say is that, you know, this is like a moment in public health where we're either going to do something or like, and I don't feel like we can really sit on the sidelines. So I'm also heading up a committee of scholars from UCLA, the Center for Racism, Social Justice and Health, the Harvard FXB Center for Health and Human Rights, folks there, and some other folks in my network to really be a COVID-19 Health Justice Advisory Committee for the Poor People's Campaign. And we see that in this moment, what we really need, what this pandemic is really exposing, is that we need to radically restructure how we do things, not just for the virus, not just for this pandemic, but the ways in which we set up our society are bad for health, they're bad for well-being. And can we use this moment to both mobilize in the present for COVID-19 and beyond? And so we're just coming alongside the Poor People's Campaign, which is a national movement to really document the ways in which poverty hits, racism and ecological devastation really has done, has created these inequities, and we need to be talking about them in a synergistic way. And so this health committee will be advising the Poor People's Campaign as they advocate for a more inclusive response from the federal government, as they think about what are the next actions that need to be taken up both by federal government and by states in order to mitigate the impacts of the disease in poor communities and communities of color, but also what does that mean for what we need to be doing beyond this moment? Because this is a moment that the whole world is literally stopped. And we really have to sit with ourselves and say, how do we reimagine what this world looks like after the COVID-19 pandemic?
Thank you, Dr. Barber, for your work, for your expertise, your time. We have a tremendous amount of work in our field in public health and beyond as we move forward to not only, as you said, address coronavirus and how it's disproportionately influencing and impacting communities of color and low-income communities, but the larger structural issues, as you mentioned, that need to be addressed. So
exactly.
Thank you so much for your time.
Yeah, thank you.
Follow Dr. Barber on Twitter at HealthEquityDoc, and to find more information about our topic from today and beyond, please visit chronicles.com. Thank you for joining us.
Thank you.